Good evening, students. Today we are going to discuss about the iris and the pupil. The iris and the pupil. To set the ball rolling, remember that the iris is divided into two major zones. It's divided into two major zones. What are they? We have the pupillary zone, okay? That's the area within the pupillary axis, the pupillary area, okay? That is, the pupillary zone is the inner region which forms the boundary of the pupil. This is the pupillary zone. This is the pupillary zone, as you can see here. Okay, pupillary zone. And then we have the ciliary zone. The ciliary zone is the rest of the iris which extends to its origin. So the pupillary zone, okay, and the rest of the iris, okay, is what? The ciliary zone, the rest of the iris around this whole area, okay? This whole area, all right, is the ciliary zone, okay? That's the ciliary zone. It moves from this region up to the origin, okay, or the root of the iris, where the anterior portion, the ciliary body, is found, all right? So that is the ciliary zone. But there's a third area which you should be aware of. We call it the collarate. This is the collarate. Okay, like the collar of your shirt. There's a sharp demarcation and a ridge at the level of the collar of your shirt. So this collarate. Have you seen some elevation over there? Okay, so the collarate is the thickest region separating the pupillary portion from the ciliary portion. Okay, basically it separates the pupillary zone, okay, from the ciliary zone. At the collarate, the sphincter and the dilator muscles overlap. All right, I will show you some more pictures later on. Okay, so the outer edge of the iris, which is known as the root of the iris, okay, the outer edge, which is known as the root of the iris, is connected, okay, to the sclera. Let me show you more pictures here. Okay, the outer edge of the iris. This is the outer edge of the iris. Okay, it's connected to what? The sclera. It's connected to the sclera. Is that clear? Great. So, what is the size of the pupil? Okay, the normal size of the pupil varies depending upon two main circumstances. Is there bright illumination or there is dim illumination? Okay, because the retina doesn't like too much light. When there is bright illumination, okay, the pupil size is between 2 to 4 millimeters. In bright illumination, in between what? 2 to 4 millimeters. When they have it, 3 millimeters. But when there's dim illumination, the average is 4 to 8 millimeters. Okay, so that is it so far as its diameter is concerned. It's important to also note that the iris has two main layers. Okay, it has two major layers. These are the stroma, okay, which is anteriorly located. All right, so talking about, look at the pupillary zone. Okay, look at the collarate. Okay, this is the collarate here. All right, and the rest is what? The ciliary zone. Okay, so the anterior portion is the stroma, while the posterior portion, which is pigmented, okay, is known as what? Pigmented epithelial cell or a pigmented epithelial layer. So the anterior portion that all of us see, okay, is known as what? The stroma. The stroma. And the posterior portion, which is difficult to see unless you are in surgery, is layer known as what? The pigment epithelial cell layer. Is that clear? Very good. So, what is the typical color of the iris? Okay, there are three major colors that the iris can have. Okay, the iris can be brown in nature, it can be green, and it can be blue. Sometimes you have mixture of some of these, and then you can have hazel. All right, but typically there are three major colors that the iris can have. For example, this particular one, okay, is brown, and sometimes people have it green, okay, others have it blue, and so on and so forth. But there are three major colors of the iris. Typically, the plural of iris is known as iridis. Anyway, so when we talk about the color of people's eyes, in fact, in effect, they are referring to the color of your iridis. So if they say your eyes are green, it means your iridis are green. In that same order, if they say your eyes are brown, it means your iridis are brown. Alright, let's talk about muscles that can be found within the iridis. For your information, there are two major muscles that the iris can have. Alright, so we have concentrically organized or oriented muscles, which is found at the inner portion of the iris, and this is known as what? The sphincter pupillae muscle. The sphincter pupillae muscle. When the sphincter pupillae muscle contracts, it constricts the aperture of the pupil. It makes the pupil become smaller or narrower. On the other hand, the other muscles that are thrown into radial folds, okay, because they are oriented radially towards the peripheral portion or the root of the iris, we have what we call the dilator pupillae muscles. And the dilator pupillae muscles are what? Oriented radially, okay, towards the root of the iris or the peripheral portion of the iris, as you can see here. When the dilator pupillae muscles contract, what do? They increase the aperture or the size of the pupil. Look at this particular picture, okay? Similarly, you see that at the inner portion here, you have the concentrically oriented sphincter pupillae muscles, which, when they contract, reduce the aperture of the pupil and constrict the pupil. On the other hand, you have more peripheral muscle, which is thrown into radial folds, okay, known as what? Dilator pupillae muscles. And when the dilator pupillae muscles contract, what do? They open up the size or the aperture of the pupil. For example, in this particular scenario, the pupil is widely dilated as a result of what? As a result of contraction from the dilator pupillae muscle. Is that clear? Let's look at this particular scenario here. On my left, the pupil is quite small. This is because the circular muscle of the iris, known as what? Constrictor pupillae muscle or the sphincter pupillae muscle, have contracted, narrowing the aperture of the pupil. But if you look at the picture on my right side, the radially oriented muscles are those that are contracting now. And for that matter, the pupil size has become what? Bigger. Okay? That is it. Sometimes in the department, when we are examining patients, if you want to see certain structures that are behind the iris, we give combination of medications. What are they? Medicine that potentiates the action of the dilator pupillary muscle so that the pupil will open up bigger. At the same time, medications that will stop, okay, or inhibit constriction of the constrictor pupillary muscle so that it does not even contract. And if it doesn't contract at all, it means all the action will be potentiated by what? The dilator pupillary muscle. That's about the muscles within the iris. So, what are the functions of the iris and, of course, the pupil? All right. Remember that the iris or the pupil regulate the amount of light which can enter onto our retina. Is that clear? It regulates the amount of light which can enter the retina. So when there's so much brightness, okay, the retina doesn't like too much light, so the constrictor pupillary will contract so that you don't have too much light going into the retina. But if you are in dim illumination, the pupil will widen up so that any little amount of light can pass through it to stimulate the photoreceptors on the retina so that it can capture image for us to see well. Remember that the iris determines the color of our eyes. As I said previously, if they tell you that the color of your eye is brown, it stands to the fact that your irides are brown. And those with green eyes is because their irides are green. So, in a nutshell, it determines the eye color. It's also important to note that the iris and, of course, the pupil, they intervene in what we call accommodation. What is accommodation? When you look at something in the distance and all of a sudden you look at your watch, your book, your mobile phone, the eyes must adjust to its present state so that you can see very well. And that is what we call accommodation. It's nothing else, nothing more than looking at something which is very close to you after your eyes were looking at something that were far. So all of a sudden, when you're looking at something which is far away, if you focus on something very close to you, what you are doing is what? Accommodation. Again, remember that the iris divides the anterior from the posterior chambers of the iris. Students, once I told you that the iris is called the iris of chambers. Why? Because it divides the anterior from the posterior chamber of the eyeball. Ladies and gentlemen, another function the iris has is that it acts as a stop to reduce spherical aberrations. What are aberrations? Aberrations are imperfections that are associated with the images that we see, images that are focused on our retina. Remember that it is not everything that we see with perfection. There are imperfections in the images that we see. Alright, and these imperfections associated with what we see is what we call aberrations. There are two major types: the chromatic, that is associated with colors, and then what? Spherical. But we can also have ocular. Okay, the ocular may fall under what? The spherical aberrations. What does it entail at all? Well, when light comes to your eyes straight forward, it makes you see things better than if it comes from the sides. Is that right? Yes. So the iris, so when light comes straight onto our eyes, we see better than if it comes from the sides. Is that right? So let's give you two scenarios. look at the iris on my left side. Okay, the iris on my left side, it acts as a stop. Why? If any light is coming from the periphery or from the sides, the iris is pigmented, dense layer, so it doesn't allow the light to travel peripherally to go and stimulate the rods. So it has stopped those images that will have gone to stimulate the rods, which gives images that are not sharp. So it has stopped. Is that clear? So it acts as what? As a stop. On the other hand, in the same eye, if a light rays comes straight ahead, it will go and stimulate the photoreceptors, specifically the cones, and our sight is better. Remember that the reason why our sight becomes blurred, especially when we are looking at something which is near, after dilatation of the pupil, is because of what? Spherical aberration. Because now the pupil is widely dilated, there is no stop, okay, from the iris, and all the light rays that are coming from the periphery enter to stimulate the rods, and that doesn't give you sharp vision. Ladies and gentlemen, that's the reason why once our pupils are dilated, we don't see things very clearly, especially the near objects. Okay, because the iris is no more acting as a stop. It has withdrawn to the periphery. But if it is not dilated, it acts as a stop and makes our sight better. So that is one of its functions, and it acts as well as a stop to reduce spherical aberration. Spherical in this case because the iris is spherical in shape or in nature. So sometimes the pupil is dilated, other times it is constricted. The question is, what causes dilatation of the pupils? Sometimes people could be dilated because there's a brain injury. Okay, like it is dilated here. Look at it dilated here. All right, there's brain injury. Sometimes increased production of oxytocin as a result of sexual arousal can bring about dilatation of the pupil. Adrenaline, okay, that are produced by your system or your body can act on the sympathetically innervated radial muscles and dilate the pupil. So when you are angry, any situation which increases adrenaline in you is capable of dilating the pupil. It could be excitement, emotional. It could also be sometimes when you are even lying about something. If only you go through what we call the fight and flight mechanisms, okay, your pupil will be what? Dilated as a result of adrenaline that's being released into your blood. Remember that certain recreational drugs can also dilate your pupil, okay? Certain recreational drugs can potentiate the radial muscles of the iris and increase the aperture of the pupil. What recreational drugs? Cocaine, okay, methamphetamines, psychedelic mushrooms, marijuana. These are all recreational drugs capable of what? Increasing the size of the pupil. Alright, these are all recreational drugs capable of increasing the size of the pupil. Okay, look at it here, it's dilated. Again, there are certain prescribed medications which can dilate the pupils. Okay, what are they? One of them is what? Antidepressants. We have antihistamines. Okay, look, the pupil here is dilated, and some of the medicines that we prescribe on daily basis can cause pupillary dilatation. And as I said, antidepressants, antihistamines, antiemetics, anti-seizure medications, atropine, for example, asthmatics, botulinum toxin, anti-Parkinsonism medications, benzodiazepines, okay, These are all medications capable of dilating the pupil. Ladies and gentlemen, remember sometimes alcoholics, remember alcohol, alright, it can be a recreational drug, and alcohol is also capable of what? Dilating the pupil, alright. So, of course, anesthetics like ketamine, okay, anesthetic agent like ketamine can dilate the pupil. And of course, we use mediatrics. Mediatrics are medications that are pharmacologically used in eye care centers to open out the pupil for diagnostic purposes. Okay, those also can also enhance or increase the size of the pupil. Sometimes the pupil is what? Constricted because there's contraction of the parasympathetically innervated constrictor pupilli muscle, also known as what? The sphincter pupilli muscle. Okay, when there's parasympathetic discharge, the pupil becomes what? Constricted. All right, but let's talk about certain medications that can lead to constriction of the pupil, like you find here. Okay, all right. So opioids. Okay, like what? Oxycodone, heroin, fentanyl, morphine, and codeine are all what? Opioids that can be used in treatment of problems in our body, but capable of constricting the pupil. Now, sometimes stroke, okay, hmm? Stroke at the level of the brain stem, to be more specific, at the pons, called the pontine stroke, right, can lead to what? Constriction of the pupil. Other times, you have neurosyphilis, okay, causing pupillary constriction from Agile Robertson pupil. Remember, sometimes high doses of cocaine and amphetamines can cause constriction of the pupil. For your information, remember, the most common drug associated with pupillary constriction are what? Opioids. Okay? Opioids. Remember, opioids are also known as what? Narcotics. And that the most commonly prescribed opioids or narcotics in our environment are what? Tramadol, morphine, and what? Codeine. Students, at this juncture, I'll leave you revise. Go over this particular YouTube material. It's quite significant. And put down certain difficulties that you may have. And once we meet in class, I'm going to clarify them for you. And to meet again, continue studying hard. See you.